Hot and humid, it can be hard to breathe. It's even worse for someone with asthma. The question is, why is it so much worse during the summer months? Joining us now is Dr. Reena Mehta with Uptown Allergy and Asthma. Good morning. How are you?
Good morning. I'm doing great. How are you?
Good, thanks. So obviously, look, when it's hot and humid outside, it's typically no fun for most people. But folks with asthma, it could be even worse. Why is that?
Exactly. So, great question. And so, during the summer months, as we know, it's very hot, it's very humid. And these are things that it makes it hard to breathe just for the regular person. So, for someone with asthma who has very sensitive, reactive airways, when you're trying to breathe in that environment, it irritates the airways even more and can cause more inflammation, which then leads to symptoms of asthma, such as shortness of breath, coughing, and wheezing. So not only is it humidity and heat, but also during this time in the summer, there's a lot of allergens. Okay, humidity causes the release of dust mites, mold, there's lots of pollen in the air. So also if you are an allergy sufferer and that triggers your asthma, breathing in those things outdoors can be really difficult for your asthma and makes it harder to breathe.
So really, you're talking about some of those outside irritants, whatever it may be, like you say, dust, pollen, grass. Everybody's mowing their lawn. That's the kind of stuff that can really irritate folks who have asthma. What can you do if you're trying to make sure that that doesn't become a problem?
So it's interesting. So also some other triggers can be like pollutants, smoke, so traffic, ozone. And so it's interesting. There's a study that showed that in summer of 2020, so this is when the COVID-19 pandemic hit, there was a lot less asthma-related hospitalizations because people were staying indoors, people were masking, and there was a lot less traffic, so there was a lot less pollution. So it's interesting that it can be so different based on what our behaviors are as a community. So my tips would be, if you know that it's a bad ozone day, that may be a day that you decide to stay indoors, being aware, checking the temperature, checking, if it is a bad air quality day. Also, if you need to be outside, you might decide to do that first thing in the morning or late in the evening when it's not as hot outside. Wearing a mask always can help filter out the allergens. And then if you are an asthma sufferer, knowing to keep your inhalers on hand. Most people with asthma have a preventative inhaler that they take every day, and then they have a rescue inhaler to keep on hand in case of an emergency. So it's really important that you keep your rescue inhaler with you at all times in a cool place. You don't want to get it too hot because then it also won't be as effective. And then understanding what your allergy triggers are, what your irritant triggers are, and then managing them. And then if you feel like your asthma is just worse than it's ever been, then you should obviously see your doctor.
Yeah, and maybe that's something too that some people may say, hey, look, it's the summer. I typically have a harder time breathing in certain situations or whatnot. Is there a chance that maybe someone might have something like asthma that crops up and they don't, it's never been diagnosed, or is there kind of like a lesser sort of affliction that might be affecting people, especially during the hot and humid times?
That's a great question. So asthma can pop up at any point in your life, and it may not be something that's there every single day. It may be that it's completely related to a specific trigger, whether you're sick, whether it's allergens, whether it's irritants, whether it's smoke. And so it's good to be aware that at any point you may start feeling those symptoms. And if you start noticing that you're more short of breath than usual, that you're coughing, that you just can't breathe well when you're outdoors, it's not a bad idea to get checked out to see whether you truly have asthma or if there's something else going on.
Right, and we were chatting. Even there's potentially some folks can just have kind of a sensitive airways that are affected by this as well.
Exactly. Some people can have just reactive airways where in general, when there's a certain irritant, their lungs just don't expand as well as they should because there's some swelling or inflammation going on. So it may not even be asthma, but there may be a little bit of reactive airway that might not even meet the definition of asthma, but yet can still make it hard to breathe. And so just being aware of what triggers you to have shortness of breath is important when you consider kind of what you're going to do around you in your environment, whether that's being outdoors, whether that's driving, whether that's being without a mask, things like that.
So overall, it seems like at the end of the day, take control of what you're dealing with, understand what you're dealing with, and if you have some problems, go see your doctor.
Exactly. It's really great to see an asthma allergy specialist, because then we can, if you don't know what your triggers are, we can help you define what might trigger your asthma and then come up with an asthma action plan or some sort of a treatment plan that can help you get through those tough times. Because asthma, again, can be triggered when there's extremes of temperature, so heat and cold. And so it's just kind of knowing that it can fluctuate like that, and getting that addressed to figure out the best plan to treat your symptoms.
All right. Well, thank you so much for joining us this morning. We certainly appreciate all those tips.